You're on mute, Lynn.
Hi, Steve.
Freddie.
What's going on, buddy?
How you doing?
I'm doing all right.
Thanks for sending that number over earlier. Appreciate it.
Oh yeah, no problem. No problem. How's everything going today?
Good.
Yeah.
Another day, another adventure.
Yeah.
Not a bad thing. How you doing?
What's that?
How you doing? How's everything with you?
I'm doing good. Just been busy.
Well, that's not what I heard, Fred. Find. All right. Anyway, let's get started. Okay. Oh, Noelle's here. Hi, Noelle. Okay, Samantha Doucette. I'll add you to the list. Okay, awesome. All right, so welcome everybody. I'm going to do like a roll call attendance just for the lead stakeholders, and those are the people that are in the that have been appointed or will be appointed. So they've been appointed by the old mayor, and now they'll probably be appointed by the new mayor tonight and sworn in. So with Mayor Kokora. So I'm just gonna, if you're here, just say here. Mary Kelleher.
Here.
Yes. Mary Ann Barrett. Not yet. Okay, Christine Fosco. Christine said she might be late if she gets on tonight. Derek, you're here.
I'm here.
Steve Leary's here. Brian Leary can't be here. He just texted. John Wilson. Okay, John's supposed to be joining us, but he's not here right now. Roger's here. Diana. Okay, not yet. You know, I have a feeling that some people won't come on till close to 6:30. They might have the time wrong. Okay, Andrew. Not yet. Mike Want is here.
I'm here, Lynn.
Oh, you're here. Hi, Andrew.
Hey.
Okay, Wes isn't here. Freddie's here. Meredith is here. Is Kathy Wood on? Not yet. Okay. Okay, cool. All right, let's go on to the next slide, Steve. All right, so here's tonight's agenda. We're going to start off with our annual meeting items. And I hope we have quorum because Marianne and Christine on here. Brian, John. So let's see, 1, 2, 3, 4, 5, 6, 7, 8. All right, we'll just move on. We're going to start with the annual meeting items. Then we're going to go into recovery coach training with Jay St. Ives. All right, so let's start annual meeting. Next slide, Steve, please. Thank you. All right, so usually, so we do have an executive order that was done in 2017 by former Mayor Sullivan. And so every year we're supposed to talk about the budget, you know, what we spent annually, and a few other things. So anyway, we did get legislative earmark funding last year, so fiscal year 20, and we got $150,000, and this is what the budget looked like. And so consultants, and Stormy was one of our consultants. We also used the Educational Development Center that helped us with our strategic planning. So that's pretty much that. And I think I have a breakdown, and if anyone wants the breakdown, please email me. I have a full coverage. I did give the members of the steering committee a copy of the expenditures. And if you want that report, I can give that to you. So we have, so program supplies, a lot of that was for digital collateral. So we purchased Zoom with it, a few things like that. Program support, we didn't have a youth development coordinator, but we did have, you know, I did pay someone to take our minutes and some other things. Let me see, training. We had we had a lot of, we didn't have as much training expenses as I thought we would because of COVID. Staff mileage and then meals. And so we probably didn't, I don't think we spent as much in meals because we had to stop meetings. And that's usually when we used to have pizza and stuff. So I do have a full breakdown of everything. And we do have quite a bit of money in a bank, a travel bank with JetBlue, because we had to cancel sending people down to Atlanta and also to Montana for 2 conferences. So that we have access to that bank for about 2 years, which is really great. They put it all in my name so I can get other people, you know, purchase tickets for other people in the future. We did Facebook boosts and we also paid a big chunk of our money went to the interface referral service, which cost us $26,000 for 2 years. So anyways, and as you can see at the bottom, it looks like it's cut off some. We did have some administrative overhead. Bay State Community Services actually was our fiscal agent. So they paid all the bills for us and did all the accounting for us. So, okay, so I just wanted, does anyone have any questions about anything that I've discussed? And if you would like a breakdown of the report, I do have the full expenditure report. Just let me know. Any questions?
I have one quick question, Lynn. It's Meredith.
Meredith, yeah.
If we didn't use the whole 150, do we get to bank that or does it go away?
Oh no, that goes away every year. So so we spend it all.
Oh, we did spend it all.
We did spend it all.
It's hard to see that.
Yes, and what I do want you to know too is this, that I totally forgot. Because of COVID, and we knew that there was going to be a lot of money that we weren't going to be able to spend. We did roughly $36,000 went back to the town as reimbursement for my salary. Because my salary is in the town budget, but that was a big chunk of money that we could get. So it saved the town some money. And we did have a lot of, you know, we did have a percentage of each department had to give back money this year. So so that was really helpful.
Thank you for that.
Yeah. And I never give back money. I mean, the first year I was here, we got a legislative earmark for $150,000 and we spent it. They didn't release the funds to us until March or April, and we had till June 30th, and we spent every penny. And part of the reason we can do that is because I don't have to be bogged down with a lot of the administrative stuff that Bay State Community Services does for us. So does anyone else have any questions? Okay, no, it's boring stuff, but it's something that we have to do. Thank you for your patience. All right, so next slide, Steve. Okay, so this year, believe it or not, we are getting a legislative earmark. I did submit a proposal. It came through Senator Walter Timilty. And the money hasn't been deposited yet, but I did submit this budget. And here is a list of the scope of services. And I just wanted people to know that I'm going to contract with someone by the name of Jason Edmonds. I've worked with him in the past. He worked with Learn to Cope and a lot of other groups, MHOA, MOA. He's going to work on a website for us that's not going to be connected. Well, it will be connected to the Town of Braintree website, but it won't have all the barriers that the Town of Braintree website has. It's really hard to find us in the Town of Braintree, on the Town of Braintree website. So he's going to create a website for us that's going to be visually appealing, maybe even some, interactive. It's going to be a way that we can help people connect with recovery services, mental health services. So I'm really looking forward to working with Jason on that. I've worked with him in the past. He does great work. It's a way to promote interface and a lot of the other services that we offer. We're also going to provide training and resources to members and partners for supporting mental health and well-being. So we may look at QPR, question persuade, response, for suicide prevention, maybe mental health first aid, and some other trainings. I also felt it was important in the Department of Public Health, with whom this money is coming from, would want us to really look at diversity, equity, and inclusion training. So we're going to be focusing some of the money on that. We hope to administer a parent survey and provide data analysis, and that's where Stormy will come in. Will help us with that. We already have one developed. I know you guys know it. We have a parent survey developed. We also have it done in several languages. So we will be hopefully administering that at some point. And then we're hoping to develop a community survey that would help us to better serve the behavioral health needs of the community. And then we want to try to expand our presence on social media. So that's where a lot of this $27,777.78 is going to go to. So does anyone have any questions about that? So that's going to be anytime now. I haven't got word yet. It hasn't been deposited. I think it's going to come in two $13,000 deposits, and it's coming to the town. Bay State will not be our administrative support on that. We're going to do that ourselves because it's a small amount of money and it'll be manageable.
We're not going to see the 150,000, or
no, we're not going to see 150,000. The state was quite clear with us. No, because of COVID and the expenses relative to COVID. So okay. We were lucky to get this. Senator Timilty got 9 communities this money, and a lot of it is because of because of substance use and mental health issues in communities. So
they're just not issuing that grant anymore? Or
it's not a grant, it's legislative earmark funds, but the same as this. And this is all we were able to get this year. And to be honest with you, this is going to be manageable because this is going to be again between like February and June that this has to be spent. Yeah. And in the process of that, I will also be writing for a drug-free community support program grant, a federal grant. And I'm going to be talking about that later on in the presentation. So I think that's released in March 15th, around March 15th, and the proposal will be due to the CDC, Center for Disease Control, in May. And I know the last time I wrote, I was successful the last time I wrote for one of these grants, and I hope to be this time, knock on wood. It's no guarantee, but it's going to take a lot of my time. It takes a lot of time. And I've talked with people individually, and certain people in this group they're going to be helping in lots of different ways. So I appreciate that. So anyways, this is manageable, Roger, for right now. And I've already done a lot of the legwork. It's just a matter of waiting for the funds to come in and contracting with the folks that are going to provide the service. And also the Educational Development Center, will be working with them again. They're going to provide technical assistance. They're going to also look at some of our grant stuff, grant writing. They're going to help with that, with the strategic plan, making sure it's in the grant properly and yada, yada. So does anyone else have any questions about this? Okay. So I guess we'll move on.
I have a question.
Steve. Oh, yes.
You know, it's not fair if I don't ask a question.
Is this Jay St. Ives?
It's me. You mentioned something about mental health first aid. So I think you're aware that Megan and I are one of the instructors for the mental health first aid.
That's wonderful.
All right, so saved you some money. There you go.
Excellent. But there might be some supplies or something that we could pay for.
We can absolutely use that.
Yes, yes. And I've also talked with the 2 chiefs. So we are going to be ordering some supplies, not naloxone cases for the police. And we're also going to be, Freddie asked, I reached out to Freddie when I was writing this budget, and we're going to be providing some resources to the fire department as well. So thanks. That's great to know, Jay, that you and Megan are doing that. I was a QPR person, but my time has run out, so I'm going to have to redo it or find someone else to do that. But Paul Williams in Weymouth, who does my work in Weymouth, is he's also a QPR instructor and has, said he could be available to us for nothing. So, okay, any other questions? Okay, so I would like to introduce two new lead stakeholders. Appointments, Mayor Kokoris. I don't know if he's in the room yet. Are you with us, Mayor?
I'm right here.
Hello there. How are you?
I'm doing great.
That's
Hello,
good.
everybody. Thank you all for participating. I appreciate it.
Well, we appreciate you attending. And so I had submitted two talent bank forms, one from Mike Want, who's the deputy police chief, and one from Wes Ray, the executive director of BCAM. Wes, so the mayor is going to, has agreed to appoint Wes as the media representative. So he'll be the lead stakeholder for media. He's not at this meeting tonight, but I spoke with him today and he says hello to everyone. And Mike Want has been assigned by, well, and he really wants the position too, but he's also been assigned by Chief DuBois. So so we welcome both Mike and Wes to the group.
Thank you.
Excellent choices.
Yes, I totally agree with you. Totally agree. So thank you for those appointments, Mayor. And I think the next slide is what we want to go to next. So we are still searching for two more lead stakeholder positions in order to qualify for the DFC grant. I have a tickle in my throat, I'm sorry. So we are looking for a civic volunteer. Meredith, Berica, and I are actually meeting with the Rotary next Thursday. So we're going to be talking to the Rotary group about maybe recruiting someone from that group to join us. Excuse me. And healthcare professional, as you all may know, Anita Young, the pharmacist from Braintree, has relocated down to the Cape, lucky girl, and is retired from the state. So she has left us. So Mary Beth McGrath may possibly fill that healthcare professional position, but with COVID right now, she's uncertain about that. So, but anyways, so that's where we're at with those. And if anybody knows anyone that they can recommend, I ask you to, please email me, text me, whatever, call me. Does anyone have any questions? Okay, so let's move on. All right, so steering committee, our current steering committee members included Andrew Marin, who represents the schools, Diana Cleary, represents an organization involved in reducing substance use. Christine Fosco is a parent, but she's also an attorney. Derek Top is a parent, but he's also and they're both young parents, which is great, so they can be with us for a long time. And Derek also works for Boston Medical Center in the Catalyst program, where he works with youth, and he's done he's done a few presentations for us. He's great. And Steve Leary, I don't know what I'd do without, well, what we'd do without Steve Leary from the mayor's office. So, and Chief DuBois was also on the steering committee, sort of like by default, because Police Chief Chastany was, and so he has actually reassigned Mike Want as a lead stakeholder, like we mentioned earlier. So, so we do have an open position. So the first thing, so what I sent an email out to all of the lead stakeholders, because it's people from the lead stakeholder group that are able to run for steering committee. And no one else had an interest. So I'm going to make a vote and I talked to us. We had a steering committee meeting last week, and these good folks on the screen here are very willing to serve for 2 more years. So, and I love them. I value them. I don't know what I would do without them. So, so anyway, I'm going to, next slide, please, Steve. I am going to entertain a motion And this is for the steering committee, though. Excuse me, these are for the steering committee, but only the lead stakeholders can vote. And I called your names out for roll call earlier. So I'm going to entertain a motion to approve a 2-year term continuation of Andrew Marin, Diana Clary, Christine Fosco, Derek Top, and Steve Leary to the steering committee. And I need someone to make that motion.
I move to approve the 2-year term.
Okay, that's made by
Roger.
Roger. And is there a second?
Second.
Is that Meredith?
Yep.
Awesome, great. Okay, so I hate to do this. Usually we do like a little ballot system, but we're not in. So I'm gonna just call off people's names, and if you can yes or no. Is that okay? Other lead stakeholders?
Sure.
Okay, all right. So Mary Kelleher.
Absolutely, yes.
Awesome, thank you. Mary Ann Barrett. Are you there, Mary Ann?
Whoop. Yep, I'm here. That's
All right.
it. Yes.
You're yes. Thank you. Christine Fosco. I know she's gonna come on later if she can get on at all. Derek. Oh, Derek really shouldn't be voting for himself.
Yeah, can I vote for myself? That
Yeah,
seems
yeah.
okay.
You're all set.
I'll do it. I think I'm allowed to. I vote yes.
You are allowed to. as a lead stakeholder, you are. Stephen Leary.
Yes.
Okay, Brian Leary, he's not here. John Wilson, are you in, John? No. Okay. Roger, you entertain the motion, so I'm sure you're good with that. Diana, are you on? No. Okay. Andrew?
Yes.
Yes. Oh, I thought you'd abstain. Mike Want, you're now a lead stakeholder.
Yes.
Yes. Okay. Wes isn't here. Fred Viola.
Yes.
Awesome. Meredith.
Yes.
Awesome. And Kathy Wood.
Yes.
Awesome. All right. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 yeses. Okay. So that motion carries. Thank you, everyone. And a big round of applause. This is a great group of folks. Thank you so much. All right. Next slide, Steve. Thank you. All right. So my next. Yes.
Can I just, I'm sorry to interrupt, but
yes.
Can I ask that we maybe take some of the next things out of order and have the mayor swear in the stakeholders? Would that be possible?
That would be absolutely possible. So let's move on to a couple of the slides, move forward. Okay, we'll go back to that. Okay, so here it is, swearing of the lead stakeholders. So those that are present, Mayor Koukouris, I'm gonna hand it over to you.
Thank you. Thank you, everyone, for continuing this great committee. So I would ask everyone to raise their right hand that is being sworn in. And I want you to repeat after me. And when I say state your name, you will state your name, okay? So is everyone ready?
Yes, sir.
All right, everyone unmute. And here we go. Raise your right hand. I state your name.
Roger Madera.
Derek Top.
Solemnly swear.
Solemnly swear.
That I will bear true faith and allegiance.
That I will bear true faith and allegiance
to the Commonwealth of Massachusetts.
To the Commonwealth of Massachusetts.
And support the Constitution thereof.
And support the Constitution thereof.
So help me God.
So help me God.
I state your name.
I, Roger Madera.
Do solemnly swear and affirm.
Do solemnly swear and affirm.
That I will faithfully and impartially.
That I will faithfully and impartially.
Discharge and perform. All the duties incumbent upon me.
All the duties incumbent
upon me.
As a lead stakeholder on the Braintree Partnership.
As a lead stakeholder on the Braintree Partnership.
On substance use.
On substance
use.
According to the best of my abilities.
According to the best of my abilities.
And understanding. agreeably to the rules
agreeably to the rules
and regulations of the Constitution,
regulations of the Constitution,
the laws of this Commonwealth,
the laws of this Commonwealth,
and the bylaws and ordinances of the town of Braintree.
and the bylaws and ordinances of the town of
Braintree.
So help me God.
So help me
Help me
God.
I state your name.
I, Michael Harris,
Do solemnly swear
Do solemnly swear
that I will support the Constitution of the United States.
that I will support the Constitution of the United States.
Help me God.
So help me
help me
God.
God.
Congratulations, everyone. You are now sworn in.
Thank you.
And thank you
On
very
the
much.
same day that we have a new president sworn in. Thank you, Mayor Kokoris.
Thank you. Thank
Thank
you.
you.
Guys, have a
Thank
great
you.
day.
Thank you.
So proud of you guys. Thank you so much. Oh, that's so nice, Noel. That's awesome. Thank you. Welcome everyone as lead stakeholders to the partnership. It's a great day. Thank you. And so I'm going to ask Steve to go back one slide, Steve. Yay. Okay, so go back to the slide before that one. Okay. So what I'm going to do is I'm going to entertain a motion. So you can go to the next slide, I think. Yep. A motion to appoint Mike Want to a 2-year term to the steering committee. So I'm going to entertain that motion, and I'm going to ask someone to make that motion. It's got to be a lead stakeholder.
So moved.
Okay, so moved. That was Freddie?
Yes.
It was.
Okay. Fred was the first. And who's second?
I'll second it.
Roger. Okay, awesome. Okay, so I'm going to go down the list again. So sorry we have to do this. Mary Kelleher.
Yes.
Mary Ann Barrett.
Yes.
Christine Fosco, not here. Derek Top.
Yes.
Stephen Leary.
Yes.
Okay, no John Wilson, no Brian. Roger.
Yes.
Awesome. Diana? Not here yet. Andrew.
Yes.
Mike Want, you're not on yet. Oh, you are. You can vote for yourself.
I'll abstain this time.
You'll abstain. Okay. Let's see who else. Freddie.
Yes.
Awesome. Meredith.
Yes.
And Kathy.
Yes.
Awesome. So let's see. We got 1, 2, 3, 4, 5, 6, 7, 8, 9 yeses and 1 abstain. So
John Wilson is signed in.
Oh, yeah. John's here. Hi, John.
Yeah. He doesn't know how to get on or heard, he said.
Oh, he's got to unmute himself.
Okay.
Steve might have to bring him over into the...
Okay.
He's here.
Hi, I need to be...
He's just muted.
I need to be made a panelist.
He is a panelist. He just needs
I am now, right? Can you guys hear me now?
Yes.
I can hear you.
Awesome.
Can't see you though.
I don't know why you can't see me, but I'll start video. Okay. I wasn't allowed to because I wasn't a panelist, but I should be seen now.
Yep.
Awesome. Hi, John.
Sorry, I've been on. I heard the whole swearing in. I raised my hand and all that other stuff, but I was like, I don't think anyone can see me or hear me. But anyway, glad to be here with you guys, and I'm so excited to have some more people part of this group. So I vote yes.
Awesome. Thank you so much, John. And it's so good to hear your voice. We miss you.
Good to see you guys.
And thank you for the email the other day.
Yeah, no problem.
Okay. All right. So congratulations to Mike Want. And
Thank you. I appreciate it.
Yeah, I'm very excited. Mike, do you want to say a few words or anything, Mike? You want to tell the group a little bit about yourself? I know we already voted before we did that, but maybe you can just give us a brief.
I'm thinking the more I talk about myself, the less votes I'll get next time.
That's not true.
I was born and raised in Braintree. Graduated Braintree High, left Braintree in '92, went to Northeastern, ended up working part-time for the Rockland Police, then got on to the Boston Police, was into the Marine Corps Reserves, and I transferred down to Braintree back in 2004 and been here ever since.
Awesome. And recently promoted, right?
Yeah. I guess everybody else didn't show up to work that day, so I got promoted. My interest in substance abuse comes from family, friends, neighbors, fellow Marines, police officers. So it's near and dear to my heart. I taught mental health first aid with Jay and Megan here at the department to a couple other departments. And I think in my second career, I'm heading towards mental health counseling. So I'm really interested in being a part of this group.
Great. Well, thank you and welcome. Yeah, I know you're going to be awesome, and you're going to be a real asset to the group. Does anyone have any questions they'd like to ask Mike before we move on?
It's very kind. Thank you.
Oh, thank you.
I think it's great. I think that's wonderful. Congratulations.
Thank you.
Okay. All right. Awesome. Thank you. Okay. So let's see what the next slide says. Okay. So we swore people in.
Yep.
And thank you. That concludes the annual meeting section of this meeting. So we can move on to bigger and better things. Thank you, everyone. I really appreciate it. And so let's move on to the next slide. Okay.
Lynn, I just had a quick.
Oh, sure, Miriam. Go ahead.
I'm sorry, I missed the roll call, and I wasn't sure if I have two girls from the.
Yes, Allie and Samantha.
Okay, I just wanted to make sure they were introduced because I wasn't there in the beginning.
Yes.
So
Thank you. And maybe what we could do is we could just have, if Allie, I don't want to put you girls on the spot, but if you, I know Allie did say, introduce herself before and said that she was the president of the SAD group, Students Against Destructive Decisions. Would you girls like to introduce yourselves?
Sure. I'm Sam. I'm the vice president of SAD.
Oh, vice president. Okay.
Yes.
Sorry about that.
And I'm Allie, and I'm the president of SAD.
Vice president. And just so you know, they made a connection with Mary Ann and came to tonight's meeting, and I'm so glad to have you here. And at some point, I'd like to be able to talk with you and even Mary, who is the lead stakeholder for students, just to get a sense of how things are going and what kinds of things that you feel we could be, doing for students or in and outside of school. So, so I hope I will be reaching out to you, and if you wouldn't mind, I'll get your emails addresses from Mary Ann. Okay, and then I'll send you some information. Is that okay?
Yes, thank you. Thank you.
Thank you. Sorry to interrupt. I just wanted to make you, because we need the youth. We definitely need youth.
Absolutely. Not about us without us, right?
Yeah, I think it'd be a great idea to work together with SAD.
That's Mary. Yes, Mary, I totally agree.
Yeah.
So thank you.
Right.
So hopefully we'll be meeting through Zoom, the three of us, and
definitely.
Yeah, that would be great. So thank you. Anybody have anything else before we move on to the recovery coach training? No. Okay. So I'm going to turn it over to Jay St. Ives, who I hope is still awake, because Jay has worked quite a bit the last 2 days. So Jay, he's going to talk a little bit about that recovery coach training that was held. It ended up being held virtually December 14th through the 17th or 18th or whatever. So I'd love for him to share a few words with us. Thank you.
So yeah, the training. So for those that don't know me, I am Braintree police officer assigned to our family services unit. My partner is on here as well, Peter Gillis. We currently have a strong partnership with the fire department and Man Health. We handle a lot of the the post overdose follow-ups that occur, but we also respond to the crisis calls, and we are heavily involved in the mental health field as well. We you know, we have a clinician, embedded clinician that comes out with us, and we do crisis calls, and we do follow-ups, mental health calls. So we're always trying to evolve and get better. We go out with Manit on every post overdose follow-up. You know, they have, you know, I go out with Catherine a lot, and we've heard about this recovery coach training. Sometimes when we go to these trainings, go to these houses, you know, we get asked a lot of questions. And, you know, over the years, I've been doing this, you know, 22 years now, police officer. And I'm always trying to search out better trainings and new ideas and current ways to improve. And we became aware of this, you know, the agency called PARI, and they were the ones that were hosting this recovery coach training. And for those that don't know who PARI is, that's the, it stands for the Police Assisted Addiction and Recovery Initiative. And that began, I believe it was in 2005 out of Gloucester, which was then called the Angel Program. So that, a lot of what they do is what Manit does. Now Manit really goes, their philosophy is, you know, for harm reduction. And a lot of times when we're out there, you know, we're giving the Narcan and we're giving the resources that are available to them and giving them information. Like I said, I began with a lot of questions come up like, what's next? What can I expect? And some of the stuff that we found I lacked was, I always wondered what the recovery coaches did, you know, so that was something that I wanted to get better. At least I'm not going to be a recovery coach. Peter's not a recovery coach right now. We're not certified for that, although there is a path to do that. But it gave us the basics of what a recovery coach does. We were fortunate enough. I didn't think the Zoom training was going to be good. I was a little hesitant on participating in, but I'll tell you, we had police departments from all over Massachusetts and out of state. Peter could probably tell you I think there was someone from Montana. So I mean, we had such, you know, so many police departments and with vast knowledge that we were all able to share. So again, this was just something we were looking at just to get another tool in our toolbox to try to, you know, expand our training. I'll tell you, the actual training itself, like I said, was 4 days. And, you know, there's a manual, of course, and it was pretty easy to go through. You know, it basically starts out with the basics, you know, define a recovery coach. Then it gets into like motivational interviewing. You know, we have a lot of the resources available to us through Lynn and Kim Kroger. So that stuff might be duplicitous with PARI, but, you know, PARI did spend a lot of time, you know, telling us what they're all about, the resources they have and resources they have available to us. We're also fortunate to know that, you know, Chief Du Bois had used PARI in Maynard. So we had kind of a, you know, an understanding what to expect. I think it was, it definitely was better than I anticipated, the training, especially with this police reform, all the stuff that's coming out right now, any additional training on motivational speaking and, you know, all the mental health stuff, they kind of intertwine together, the mental health and the drug stuff. So it was really a great opportunity for us to, you know, and the entire family services unit went to this training. So that was Officer Gillis, Lisa Fahey, who's the school resource officer, and I'm our Sergeant Massesso is our, you know, our commander of the unit. So we were all fortunate enough to go. And actually we went with Megan Scott too. So she was the embedded clinician. So we were really, it was a great team effort. I think we came out of there with some new resources, maybe some new ideas. You know, again, this is not about what's better or what's, you know, it's more about creating that partnership, a team, you know, where we can all get together. You know, I know PARI has gone out with Manit in some of the towns that they, you know, I think it was Hull. I thought they went out together at times. So, I mean, there's a lot of things we can do with this. It's in its infancy, but we're looking forward to seeing what we can do.
Excellent. Does anyone have any questions for Jay?
Just not so much a question, but just thank you to them. Jay, Peter Gillis, Jamie, all those people that go out and do this stuff and kind of being in the weeds with them and seeing some of this stuff. It's just I don't know that people realize how valuable that is and how valuable they are to us. So just wanted to say thank you. That's all.
Yeah. Lynn, this is Meredith. I want to echo Freddie's sentiment and thank this effort and on behalf for the police department. I don't think the residents know that we offer this family services to the extent we do. And I'm curious if, you know, what do you see as either outreach for this program or next steps, just in general for letting the town and the residents know about all this not just critical, but I would say in many ways like avant-garde work that I don't think you're getting credit for, to be honest. So I'd love to hear like what next steps are.
Well, just on my end anyway, and I was going to speak to it later on in the meeting, but we can talk about it now. I was going to talk about it before Freddie talked about the overdose numbers. I have actually sent actually reviewed our manual and sent it over to Chief Du Bois for the outreach, the post-overdose outreach. And Kim Kroger at Minute has already looked at it, and Catherine Wartz. Freddie, you should probably look at it too. I updated all the contact information. Jay's in there, Peter Gillis is in there. And hopefully what we'll do is we will sign another memorandum of agreement with Manat. And just so you know the difference between Manat and Pari, and I know that the new chief was the one who introduced Pari, I believe. Manat, the State Department of Public Health contracts with a number of different public health agencies. So for instance, Manat Community Health Center is an agency that they contract with to provide post-overdose services, harm reduction services, naloxone, Narcan training and that kind of thing. But a lot of smaller communities don't have a Manat connected with them. So for instance, like some of the smaller towns, maybe south of us, will use Pari because they don't have, they might go in with maybe 3 or 4 other communities and use Pari together and come up with funding or whatever to do this. But we get the services free from Manat. And I think what we just need to realize here in Braintree is that, just to sit down and talk once more about the services that Manat can offer. We've had some staff turnover, not a lot, but Manat can also, and I know that Catherine's gone out, and I think she went out with you, Jay, to some of the hotels up on Wood Road where we've had some overdoses. And they can provide naloxone training there and all those kinds of things. So we just really want to talk about what they can and can't do, and how we can expand that. And we're also going to highlight some of this information on the new website. I'm not sure about how I feel about, there's still a lot of stigma attached, and families sometimes struggle that have, a chronic overdose at their address. But this program can also help people who, have some addiction issues, but maybe don't overdose. So I do want to make that known to people. So anyways, I think our next steps is to, once we all review the manual, and before we sign the MOU, obviously Mayor Kokoris has to look at it, as well as Nicole Top, the chief of staff. But anyway, so that's where does that answer your question, Meredith? It was a long answer, but.
Yeah, I just think it's such a critical component of what, not just what we do at the partnership, but what the Braintree Police Department does on behalf of the community, that I think is, like I said, it's so critical, and it's good for people to know the amount of, you know, compassionate outreach that's going on. So
yeah, the police have been great.
Yeah, I think it's you know, it's ever changing and ever evolving. And last I looked, I think Power was involved in like 111 Massachusetts towns. You know, so they're out there. Management's been fantastic. So this is only going to make us better. You know, the more resources, the more people we have involved. I mean, we all have the same common goal here. That's why we're all part of this. You know, everybody.
Absolutely.
Somebody, or you know, so I'm excited for it.
And Jay, I would be very interested in if there's anything that you feel that should be added to resources and that kind of stuff. Maybe we can connect. You know, maybe next week or the week after or whatever. Get some rest first, and then we can connect.
Lynn, I just have a quick thing. It's
Marianne. Okay.
I just want to Meredith. I actually I went through the recovery coach training through CARC.
That's the one we had. Yes.
Yes. So I got the 5-day. I still need the ethical to be certified. So you don't have to be like a policeman to do it. So it's very good to know that other people can do it and help people. And, you know, I am not a registered certified recovery coach, but basically I just went through a different, you know, not
same training, but it was right directly from the Connecticut folks. Yeah.
There's more people out there than just the police station and stuff that are willing to help, you know?
Thanks, Marianne.
Which is good point. To know.
Great.
Yeah. And Manit also has a recovery coach, and there are recovery coaches at the recovery center as well. So maybe, you know, maybe we could reach out to Warren Nicoli at the recovery center and talk a little bit more about, you know, if there's ways that they can help. And obviously it's very difficult now with COVID, but we still have a lot of work to do, but I really appreciate everything that everyone is doing, and the police are doing a great job. And thank you for attending that training. I think any time we can learn more about how to, you know, interact with people that are going through mental health or substance use issues, and that stuff is only it's another tool in the toolbox. So thank you guys for doing that.
You're welcome.
Any other questions for Jay?
Lynn, I just offering that I supervise recovery coaches at BMC as part of our team. And if there's anything I can help with, you know,
Eric, you wear so many hats. I love it.
Yeah. So, yeah, and I've been part of kind of making recovery coaches part of the clinical model at BMC. So, you know, if I can help in any way in terms of thinking through some of this stuff with you guys, let me know.
Awesome.
I think also, I should have mentioned it, but, you know, they have asked me to, so one of the things that was great about this training, we had all types of people in all different fields involved in the training. But one thing that I took out of it was they had a Boston police officer who you might know, Josh, I don't know, but he's heavily involved with PARI, involved as a recovery coach. I think he could be certified, I forget now, but he was one of the instructors. And so they asked me to be, you know, I'll be becoming an instructor as well. They asked me to instruct with them. So I will have more information soon as we get better at it.
Awesome. Thank you, Jay. Any other questions? And I see some new faces. Brianna. Hi. Okay, awesome. Well, with that said, let's move on to the next slide, please, Steve. Oh, Steve fell asleep. No, I'm just kidding. Okay, Coalition Satisfaction Survey is up next on the agenda. And if you could, just wanted to yeah, you can go on to the next slide, Steve. Thank you. I don't know, people who have been here for a while know that every year I try to do a member satisfaction survey. So I have already sent it out to the steering committee members. It takes about approximately 10 minutes to complete. It's open, it's available. Once you get the link, it's available starting today, and it'll be, I'm gonna close it on February 5th. Hopefully we'll, like every year, I think Andrew might have presented one year the results. So it's really important for me to make sure that people feel like they're a part of this team, that they know what the mission is, that we, you know, that they get out of it or get from it what you know, what we're supposed to do. So anyway, I really would like people to take that survey. And if anyone from the steering committee already took it and wants to chime in, please feel free to do that, to talk about it. Nope. Okay.
I did it.
Oh,
well, no,
Derek?
I didn't finish it.
You didn't finish it. Don't tell me it took you longer than 10
No,
minutes.
no, I got interrupted. So I just don't want you to go check and see that, you know, like it's not actually done. But I was well along, and I was doing it at work when I shouldn't have been. And,
Derek's lying about his homework.
Yeah, exactly.
The dog ate it. No.
Yeah, I have 2 dogs. They both ate it. But I did. It's good.
Thank you. Well, it's important for me to make sure that everybody feels a part of this team, that, you know, anyway, I hope that you will all take it. My hope is to send it out, the link out tomorrow, and for people to complete it, spend 10 minutes before February 5th. And then at a future meeting, we will share the results. And this will be our 3rd year maybe doing it. So, so I guess it would be good to see if we're making any, you know, if we're making progress. So anyway, that's it. All I have to say about that. Any questions? Okay.
I just want to say, I think it's great. We just did a department-wide survey for the first time here a couple of months ago. We had 80% participation, and the feedback was great. People feel like they're getting, their voices are being heard. There's a little buy-in, extra buy-in, I think. So I think it's great.
Awesome. Was that Mike?
Yes, ma'am.
Yes, thank you. Thank you for sharing that. Okay, all right. So let's move on to the next. If there aren't any more questions, we'll move on. Okay, overdose and post-overdose support. And I already talked about the post-overdose support, and I will touch base with Jay and other members of the police and fire. But let's go on to Freddie. I think the next slide, Freddie. I think I got them right. Oh, okay, you can move on from that. Will, I already talked about that. Okay.
All right, good evening, everybody. Just real quick about me, if you don't know me, I'm Lieutenant Freddie Viola, Braintree Fire Department, EMS coordinator, and continue to be a proud member of the partnership and proud member of the public safety teams in Braintree, which police, fire, and ambulance, which really are the groundwork that starts all the life-saving efforts. So you can move right along if you'd like that next slide. So the data in here, these calls are called overdose calls, but that's how we receive them. So you'll see there's a little bit of a disparity just between the total number and the number of Narcan deployments, and that's just because of it comes in as an overdose. We get there and it's not a opiate overdose, or it's not, you know, it was called in differently and it wasn't really an overdose. And so that's why you see that, just as, you know, a matter of record here. The numbers on the slides are a Narcan deployment from police and fire. Area maps that you'll see are not concentrated, so we don't have like one hot zone. Although in speaking with Jay and just going over some of the intel that we had, they had an issue along the Washington Street corridor for a little bit. I'm not sure how that's progressed, but hopefully it's on the downslide. Let's see. So police and fire, in case you don't know that, in this town, carry naloxone as the first line of defense. We respond to all 911 calls, police and fire. And we have a great team that is very dedicated, very professional. And then when the follow-up team comes back in, like I spoke earlier, it's just, it's pretty awesome. So my first order of business, when I'm notified at the fire department of an overdose, because my team notifies me, and I immediately send text to Peter or Jay or someone or Jamie, and they get right back to me. Yep, we know, or hey, great, thanks. And that's that line of communication that's so important for the follow-ups. Next slide, please. So you can see we responded. Now, remember, this is 2020, so January 1 to January. Actually, this is today. My number says 82 on the next slide or whatever, but 89 calls for overdose, and that's in that full year. Those red dots that you see down on the map are the areas and the actual addresses of the calls. So you can see it's spread out across the entire town. It's not just one hotbed somewhere that we always go to all the time. So the 89 is the number up until today. So that's basically the same number as last year, believe it or not. The numbers that Jay and myself and Brewster come up with is 82. So from January 1 to January 1, it's 82. So since the first, there's been 7 others or 8 others. I went to Blue Hills, sorry. So if you could,
a boat kid, huh?
You could go to the next slide. So this is just a bigger picture of the town, geographically where those calls were. And I know it really, it's sort of confusing to look at, but what I want you to see is that spread, that nothing is really, the South Shore Plaza or behind Shaw's or something like that. It's everywhere, unfortunately. So next slide, please. So like I mentioned, we had 82, down from 89 is what I put from last year. And then that's the naloxone deployments within the town. I'm sorry, the overdose calls. Naloxone deployments, you can see of those 82, 50, that's supposed to be 52, I apologize. 52 of those were by police and fire first line. One or the other we don't take tallies. We just want to make sure that it's getting in there. So of those 82, 52 of them, we administered naloxone on scene. Now, there is, unfortunately, to report 11 deaths. We can't really narrow it down or dig down deep enough to say that they were definitely opioid derivative deaths or, but they are from an overdose or a substance use of some sort. And that's where I rely on Jay and the follow-up team to sort of get that sort of information. I hate all of those numbers. I wish they were all at 0, especially the S show of a year that we had for 2020. Just people being locked in and just the whole stress of everything else, I think just will exacerbate this year's numbers, I think. That's my own personal opinion. But so moving forward, next slide, please. So I think I'm just repeating myself, but remember that an overdose call to us is a lot different than what we're thinking here as a partnership. Overdose is the original 911 call. Oh my God, someone's overdosing. And we get there and then we make an assessment. And of course that will trickle down and make that number smaller depending on what's going on at the residence. The statistics though, with the 52 out of the 82 show the importance of first responders, Narcan availability. Since day one, I've been a huge believer in it. I think that Manit and some of the other programs that give Narcan to families is huge. I've been on scene myself at different calls where the family has given that first dose. Sometimes it's a little chaotic because, in the middle of that, we do this all the time. So when we get there, we're supposed to be that calming voice. So sometimes when the family's given, it's not always correct or enough for, I'm not giving, I just want them to give it. And if they don't give it right, that's fine. We'll just give them more. Just again, my personal thoughts, I wonder how many folks we missed last year because, the 2020, the year that it was, the people being locked in and feeling like they're not part of anything. And, did someone overdose, pass away and was found 2 days later that we didn't know because no one was there to call or, all of those things that I think about that a lot with those locked in people and not just narcotics or opioids or anything. I'm talking about alcohol and mental health issues and it's everywhere, and it's really sad. And I hope that 2021 is much better. I hope we can focus on human interaction and getting out to actually reach out to these people and help them. So just positive vibes, hopefully, and getting some people. And I will leave on a positive note. I think I told you at the last meeting that my addicted or formerly addicted, I don't know, my nephew who had some issues with addiction, who was pregnant last time, his baby was born this morning. So the light at the end of the tunnel is just getting brighter and brighter for him. So it's awesome.
Congratulations.
Yes, it's good, really good stuff. So I don't think there's another slide, is there?
I think there's one more. Just to thank you.
Yeah, just for questions. And again, I know I'm probably biased. I'm definitely biased, but I don't think that people realize just how awesome the public safety teams are in Braintree. But police, fire, ambulance, compassionate, caring, professional people that go out there every day and do this stuff. And yes, I'm part of it, and maybe it's not fair for me to say it, but I will say it 100 times and 1,000,000 times over. So with that, if I can answer anyone's questions, I'd be happy to.
I believe.
Thanks.
I have a question for families who want Narcan, who maybe have a family member at home. How would they get it?
Well, a lot of times they can get it through like a Manit or
a pharmacy.
Or a pharmacy. Yeah, I was just going to say they can get it or buy it or just fill out forms that they're a family member of someone with addiction problems. So
is it covered by insurance?
Yes.
Yep.
And Meredith, when we talk about Rotary, we can talk a little bit more about that. I'd be happy to answer your questions.
Thank you.
The state has come a long way, and I was just talking with Ed Leahy, who was on a coalition that I was a part of years ago, and he actually helped the Irish manufacturer, the Irish company that manufactured the one-step Narcan, the news. Remember how you used to have to screw it together, and it was, so he helped them create the one-step, and he's actually supplies the state, and they're doing a fantastic job. The police get it. There's an avenue for which they get it through grants, and the fire gets it through grants. This is my dog barking. And then Sarah Ruiz at the Department of Public Health. Stop. At the Department of Public Health actually supplies, gets enough to supply over 20 agencies, like the Manits of the world, and Learn to Cope and stuff like that. So it's really wonderful. It's available. It's out there. There's standing orders at pharmacies. So I do want to we will have a big section on the website about that, about how to obtain it. And then what else did I want to say about that?
You do at-risk overdose, follow-ups. If we get information where someone's at risk, I'll go out with Catherine. We've done this in the past. So all you have to do is email me, just as long as they know we're coming or they're okay with it. Or even if we had a conversation, they were unaware, I'm sure we can figure something out. Wouldn't be a problem.
That's awesome. So Jay, you and Catherine from Manit can do that. That's wonderful. The only thing I was just curious about, and I know that Robin Houston Beam wasn't able to be here tonight. Robin is the founder of the Sun Will Rise Foundation. It's the grief support.
Yep.
And I just want to make sure, and I'm not sure if it's happening or not, but that people are getting information after there's a resident that's lost a loved one, that we're getting that information out to people on the various support groups in the area, and that one, Sun Will Rise, being the biggest. So we'll probably need to talk more about that too. Do you know, Jay, if that's happening or?
Yeah, so Megan and I, that kind of morphed into something Megan and I began doing. I'm not sure we were aware. We'll probably use the resources you gave us, but Megan and I would do a lot of our follow-ups with that and offer assistance.
Awesome, that's great. And I just, so I worked with Robin Houston Bean a couple of weeks ago, and we have a new list. So things have changed with some of the services other than hers. And of course, a lot of them are virtual. So I do want you to know, I can get you that information.
Change is good.
Okay. All right. Awesome.
Hey, Lynn,
yes.
Would you mind if I asked a quick question? This is John.
Of course, John.
Just following up with from Meredith's question as well, when you're asking about where you got it from. I attended a Narcan training through the partnership maybe a year or two ago. And at the training, they were giving Narcan out, which is where we got some, we have some on site at our church in case, you know, anybody shows up to church and needs it. So I don't know if that's something in the works, that if even in COVID season, if we were allowed to do in-person trainings, but that was really helpful for me to be able to get Narcan because it was available at the training. So I don't know if there's anything like that that's available coming up soon in 2021 where people could maybe go to training and get some Narcan that way as well.
I mean, if there's a need, John, we will certainly do that. And again, with a lot of this stuff that we can't do in person, when I was talking with Ed, he was saying that now it's very different. The training is different than it used to be because we don't have to put the kit together and all that kind of stuff. So he said it's just, it's so much easier to just follow the instructions on the packaging. And DPH also has like a kit that those are the only two things that we should be using, that people should be using for the training. And so, but I do agree, if there's a need for it, let's do it. And that will be part of our community survey. We'll probably want to include that. But I do want you to know that everyone who has Narcan, and you should check yours out, John, there is an expiration date on them.
I was thinking about that when I was talking. I was like, I got to make sure it's still.
It's still
good.
useful.
I might need a new supply.
So so what you would do in that case is you would contact Manit and they would replace it for you. So
yeah, if I could just say, and you know, if you see it, and it says, you know, it's not like milk. So if it's January 31st, don't throw it away or not use it until you get the new one. You probably know that. I don't want to, you know. I don't want to offend anybody, but just, you know, sometimes people think, oh my God, that date, it's no good. It'll kill them, but
it won't.
You don't get.
It'll have some strength. It'll have enough strength to it until you can get a new one.
In fact, what I do with some of the older ones is give them to canine officers for their dogs. So they still do work, but they're just not as effective, right?
And Noelle did say, I just saw in the chat, Noelle did say that, that, you know, training can be done virtually as well. So thank you for that, Noelle. So that might be part of our community survey to ask about the need for trainings, or do they know where to get it or whatever. So we'll figure that out. Thank you, John. That was a great question.
John, I just want to follow up on John's point there. John, if you can just send me an email on what kind of Narcan you have. I'm the Narcan guy, I guess. I'll give myself the title. So that might be something that we can help you with getting, because I turn in any expired Narcans that we have in the cruises. Yeah. So if it's something that matches what we carry, I'm sure we can figure something out.
I'll take a picture and find a way to email it to you tomorrow, hopefully, when I get over there.
Very good.
Yeah, thank you.
I was going to say, when I replaced the ones that expired at the youth center, I just went to Manit. They were looking for the old ones.
Yeah.
And I just gave them the old ones and they gave me new ones.
Because thank you for that, Roger, because they do track it. Yeah. So it's probably best that you go through Manit if you got it from Manit, and then they can track like if it was used, if it wasn't used, if they gave replacements or whatever. Just for their data, I think it's probably good to do it that way. But whatever way works.
Lynn, I have a couple questions for
Yes, Stormy.
And maybe some of the other police officers. I was just wondering, in terms of the data that you have, I think I already asked this question once before, but are you able to extract, I know not exact ages of individuals who were reported because that's confidential, but maybe age groups? Are you able to do that? Like under 18 and then 18 to 30 and then middle aged and then like older? Are you able to do that? My second question is, I think there's been new data or just a lot of talks among, I guess, in the Department of Public Health, the Massachusetts Department of Public Health, about increasing usage of methamphetamine among not only, I guess, residents or people who live in Boston, but I guess they're starting to creep into the South Shore community. And it's also a growing trend within, it's starting to grow within our youth too. And that's what people are seeing. I was wondering if any of your reports for overdoses can distinguish that. I'm not sure. And I don't know if you can answer that, or any of the other police officers or other first responders can answer that. I guess also besides your methamphetamines, are you guys able to distinguish between other substances after, you know, like not then and there, but maybe the follow-ups in regards to not just methamphetamines and other opioids, but maybe also alcohol too, or even vaping, I guess, too much like concentrated THC vapes. And then this is my last question. Sorry, that's a lot of questions.
Stormy's our data girl, in case you haven't noticed.
This is my last question. I think this is more for police officers, but I know when, or maybe even the fire department, I know in the South Shore, I think in certain communities now, once an overdose is reported in a community, but that person isn't from that person is a resident of a neighboring community, do you guys still communicate with, each other? I mean, you guys as in
other departments.
That other departments.
I want to answer that one because that one's the easy one. That's a layup for me, so I'll take that. So
okay.
Peter and I manage what's called the SIMS system. It's CIMS, and yes, the answer to your question is we do get data from other towns, Braintree residents that will overdose in another town. Right now, Plymouth County just joined on. So we get stuff. We had stuff. Peter just sent something out about a half hour ago from a neighboring town. Might have been Weymouth. So yes, we do get that data. As far as the ages go, I think that would be something I could do, depending upon, Deputy Chief wants permission. That if just an age, basically, I'd have to just go through every overdose we have and just kind of, come up with a scale. That's something probably Peter would be best at. What was the other question? I do have it broke down by months. That's how our SIM system punches out the information right now. So I do have that, but I don't have ages. What was the other question? It was like 5.
About meth and...
Oh, meth.
Yeah.
Meth is definitely here. We have seen an uptick in that. Recently, I went to some training with Megan Scott, our clinician, and I think Peter went to it too. So we are seeing an uptick in meth, but I've been hearing this for 22 years of policing that meth is coming, but I finally believe it now. We have had some meth overdoses. As far as recognizing an overdose, some of our offices are called drug recognition experts. I've been to the mid-level training for this, and different drugs, as everybody probably on this panel knows, they give different symptoms and signs. And a lot of us recognize that right away. Certainly the paramedics that go to the scene. So that is something that we are cognizant of when we're there. We ask the questions when we're there. What did you take? Or a family member, we get that, we glean that information, on scene if we can. So we're always, and we're tracking that as well. As far as vaping goes, that's something that's obviously our biggest problem right now probably would be the schools. It's a big, area of use. That is something that we're constantly being trained on. There's different schools of thought. I guess I get that on how to handle that. There's different alarms that the schools can have that will trigger if someone's vaping, and there's different beliefs on whether or not to use them or not. But that is something that we're always trying to figure out. It is a big problem in Braintree, I can tell you that. A lot of kids here are vaping for sure, 100%, with THC and probably other things involved in that. So going forward, I'm sure we'll look into, where are they getting it from? So we always ask those questions when we stumble upon it. It's not always easy with these kids. They're pretty savvy. So any other question? I think there might have been one more.
Jay, can I jump in?
Yeah, please.
Yeah, so Stormy, the Norfolk County Critical Incident Management System, that's like basically it's a database that we enter all the overdose data into. I just looked real quick, and yeah, it runs, if you run a report, it breaks it down by gender and age in 10-year, like, brackets. And Jay touched on it. Yeah, so if somebody overdoses in Braintree, they live in Weymouth, they live in Holbrook, anywhere in Plymouth County. When I enter it into the system, it sends a notification to designees, because there's pretty much overdose outreach offices in every single department now in the state. And it goes twofold. If somebody from Braintree overdoses in Kingston, Jay and I will get an email to be notified. So that's all I got.
Thank you very much.
Yeah, that's very helpful.
So I just wanted to Jay and Peter and Mike, we are going to be applying for that federal grant, and we just administered, back in last February, we administered the youth health survey at the high school. We're going to be talking about that in a minute. We're Stormy and Andrew and I are going to be presenting before a group, and you'll see it on a slide on February 4th. We had scheduled it in December, and it had to be postponed. So, and so we're going to be talking about sharing that data with the school folks, and then coming up with and then talking about the kinds of strategies we can put into place, and that we'll probably write into this grant. So it would be really nice to maybe look at some of your data as well, because the more data that we have, the better we can formulate plans, and we can also provide that in the grant application. So so we can talk about that at a later time if that's okay. If you guys can do that, that would be terrific.
Absolutely.
Okay. Anybody else have any questions? Hello, Mary Beth. Well, thank you very much, Freddie, and thank you, Jay and Peter, for this section of the meeting. I really appreciate it. So let's move on. Surveys. So next slide, Steve. So again, here are the folks that we're going to present to on February 4th about the youth health survey findings. I want to thank Andrew for setting that up. I also want to thank Stormy for doing all the analytics through Qualtrics, and she did a fabulous job, and we have a really good presentation, which I hope we can share with the rest of the team here. But of course, we have to share it with the schools first, and then they may want us to share it with the school committee next before sharing it with this group. But lots of interesting things, lots of trends, and I'm looking forward to sharing that with everyone. And we will use a lot of that data in our grant application. Next slide, Steve. Okay, and the parent survey that we talked about, the steering committee is reviewing the survey. I've already got some feedback. Stormy and Lynn will revise with guidance from Scott Famika. He's the state evaluator. He works out at SSRE. I really want to make sure that the questions are all relevant, that the state has been providing us with a lot of guidance. If we're going to do surveys at all, we want to make sure that they're relevant to the time. COVID has changed things up a lot, so we just want to make sure that the questions are relative. And we're going to work with the school administration to determine when we're going to, so after we meet with them on the 4th, we'll have a better sense of when we're going to release the parent survey in the community and what the communication plan is. So I know the schools really want to push it through the schools, but there are other ways to do it as well. So I'll keep you updated on that. Does anyone have any questions? Do you have anything to add, Stormy?
No.
Okay. All right, awesome. Next slide, please. Okay, and then the scope of work for the $27,000 legislative earmark in the scope of work, we did put a community survey in. So Stormy and I will be working on that. We want to really be informed about the behavioral health needs of the community. And we also want to be able to provide what's needed for the partnership website. So, and probably I'll be talking with Brianna and everyone else about, you know, other partners about that as well. So does anyone have any questions about that? That's in our scope of work that will end on June 30th. So at least we want to develop it. We might not administer it yet, but at least we want to develop it.
I think for individuals who are sector representatives, if they also want to learn anything from about like in terms of from the community and how they can better serve the community, we will also welcome those questions too. It's not, and I think, yeah, like the survey is really mainly for trying to see how we can better serve the behavioral health needs of the community. But I think in general, I think it's just how can we better serve the community as the partnership and as, I guess, sectors of the partnership. So if you have any questions that you would like to know from our residents, just send Lynn, or Lynn can ask personally to each sector too.
Yeah, so if you have any questions, but I will reach out to people. Thank you, Stormy. That's awesome idea. So I just wrote that down. Thank you so much. Does anyone have any other questions? And that includes students. Does anyone have any questions about community survey? Okay, let's move on. Okay, SAPSI MOPSI updates. Next slide, please. And so, of course, our partners at Bay State Community Services, we have a new SAPSI coordinator. Her name is Anna Collins, and she is in the room, I believe. Anna, would you like to just say a few words to the team?
Sure, yeah, I'm so happy to be here. It's nice to see everybody and meet you all virtually. I came on as one of the prevention coordinators at Bay State just a few months ago. I also went to Northeastern. And yeah, so I'm just really excited. And I don't know, Lynn, did you want me to give my quick update now or?
Sure. I just want to say Anna has, so, you know, when Alejandro retired from Bay State, Brianna Keating was promoted, and Brianna's here with us tonight, from the coordinator to the director position. So Anna is going to be the SAPSI MOPSI person. And I want to thank Brianna. I think it was Stormy and I that were helped with the interviews for the position. We did meet with Anna, and very impressive. Anna's doing a great job. We've already had a few meetings, mental health subcommittee meetings as well. And I think she's going to be a great addition. So welcome, Anna.
Thank you.
And let's see what the next slide has to say, Anna. I think this is where, so Anna, talk a little bit about the care packages, the mental health care packages. And this is kind of, then I'll explain this slide.
Sure. Yeah, so as Lynn had mentioned, we, as part of the MOPSI, we created a subcommittee for mental health capacity. And one of the first things that we're wanting to do is distribute mental health care packages within our communities. So, you know, we're just trying to figure out how and what to include in them. So specific resources to Braintree, but also ones that are available across all of our communities. Yeah, so we're really sort of like in the formulating stages still, just trying to decide which resources we want to include and how we're going to distribute them. But, you know, just including things like, you know, breathing exercises, what we can do during COVID to release stress and manage our mental health. Because I think, as many people have mentioned before, that's really a big focus, I feel like, for a lot of people. And I think that's what the community and a lot of the communities are really in need of. So, yeah.
Thank you for explaining that, Anna. And just, I know there's some new people on the call. What Anna is doing is working with other communities. So it's Quincy, Braintree, Weymouth, Who else is in our SAPSI and MOPSI? Stoughton, Milton, and Stormy also works for Milton. So, so this is like a regional kind of initiative. And so I did bring this up at our steering committee meeting last week. And as you can see on the left-hand side, we really want to know what, and so SAPSI is Substance Abuse Prevention Collaborative. That's what SAPSI means, and that's the acronym. And MOPSI is the Massachusetts Opioid Abuse Prevention Collaborative. And thank you for that text message, Mary Ann, because she said that some people don't know what those acronyms mean. So that's what they mean. So anyway, so I did talk about this initiative at the steering committee meeting last week. And so you see on the column to the left, these are the kinds of things that we want to include in the resource list for Braintree. So we have the interface referral service, so we really want to make sure that that's there. The Massachusetts Substance Use Helpline, the partnership itself, what we do, and Derek, I think, mentioned the Partnership for Drug-Free Kids, which is a great resource. Grief support services, information about Marge Crispin, suicide prevention information, the Bridge program at South Shore Hospital, which is, I think we had a presentation about that earlier last year. It's that new program through the Graken Foundation. And, you know, to help with substance use disorder. And then the Quincy Family Resource Center. And I didn't know if anybody else in the group has anything that they feel like we should add to that list for our specific resource list to go into that care package.
Was this, I'm sorry, was this the substance abuse or was this for mental health? I got lost there.
Okay, so the Substance Abuse Prevention Collaborative has a mental health subcommittee. And because there's a lot of issues going on, people have a lot of mental health and substance use issues, this is a way that we can support mental health.
So you can have both.
You can have both, exactly.
So you can do mental health and substance use. Yeah.
Should Aspire be in there, one of our partners?
What? Aspire, yes, and they actually, yes, and I believe that they work with the Bridge program. But you're right. I mean, we have Aspire, Megan Scott, the clinician who works with the police, works for Aspire. So yes, I think that's a great resource to add. Thank you, Jay.
Okay.
And if there's any, oh, go ahead.
For the potential partners, is the reason why it's just Stop and Shop and not including another grocery store that we have in Braintree, like Shaw's or I don't know who else?
Roach, who knows? No, it's not. No.
Well, one of the reasons I think we put Stop and Shop is because, like, I think in terms of pharmacies like Walgreens and CVS, first of all, I think they're going to be very hung up with COVID because they're going to be delivering a lot of the vaccine to folks. But I also know that you have to go through their corporate offices. You can't go through stores to get permission. So I'm working on a letter to reach out to them. But Stop and Shop is actually housed as base. Their home base is in Quincy. So we may have a better shot with them. I don't know about Shaw's, but that was just a thought that people put out there. So we can add the others. We just have to figure out how to do it. And like I said, if we have to wait too long to get permission, corporate permission and stuff, it might not be something that we could actually act on.
What about, I don't know about like for potential partners, what about faith communities? Are they, I mean, I don't know if they're meeting or not. My church isn't meeting in person, but we still like to distribute meals. We still do like a lot of service orientated stuff. I think they would also be a really great partner.
Agreed. John, I don't know if you're meeting regularly, and Sue Penson is also has a church here in Braintree, but any thoughts on that?
Yeah, I mean, I think most of the faith-based communities would probably love to be able to help. I was thinking about saying something. I didn't want to volunteer because I can't volunteer for every church or organization or like I just not. I do know as hard as this has been this last year, it's hurt the resources that a lot of faith communities and churches have. So I don't want to be able to volunteer people and say, hey, go to this place. I also know a lot of them are not holding regular meetings and or even office hours. So getting in touch with some of the faith communities might be difficult as well. So it'd be hard to like, hey, call this number. I don't know that everyone will have an opportunity. So my answer I would love to say yes, because I do think there is a role for faith communities in this. I don't know that I'm ready to volunteer anybody. I can volunteer our church.
No,
like,
John, the ask is that,
but I can't, you know what I'm saying?
Yeah, the ask, John, is that we would put together the care packages and that we're just looking for potential partners to distribute this information. So if your church could take, you know, some of these care packages and get them out to people, or just say they're available for pickup. I know I did something similar this summer in the fall with the library. Every Wednesday, people can drive by and pick up like a craft activity for their kids or whatever. And so we did one of those red ribbon activities that we do. So, and that's all it was, is like I think Marianne and I put them together and and sent them over to the library. So that's basically what we're talking about.
Sure. And as I've shared with this group before over the years that I've been able to be part of this, and I'm thankful for the, you know, being included. If there's ever a time where you need 20 or 30 or 40 volunteers, I mean, I can get that in a day. Like we'll show up, and if you need stuff delivered, that's like, that wouldn't be a problem. So I will happily volunteer for that.
Okay, awesome.
Some other churches would too. So yes, if you want to just add our name for that, absolutely. And Stormy, I really appreciate you thinking about that. I didn't want to volunteer myself, but I'm happy to respond to that when somebody calls me out. So that's fine. No problem.
That's why we have you, Stormy.
Great. That is great. That is great.
So there's a question in the chat box.
Oh no,
okay.
I'm just thinking.
No, from Jennifer Lynn. Jennifer, do you want to say something?
Yeah, I have a friend whose husband is a pastor at a local church in Braintree. So you're looking for places that would be able to distribute these packages, right?
Exactly.
Okay. I don't know if they'd be able. I'm not part of the church, but I don't know if they'd be able to. I don't know what they're doing for services right now. I know for a while, I think they were trying to do some in-person things, but I'm happy to reach out to my friend to see if her husband and their church can do anything. I know she runs youth groups there.
So we got to talk about that anyway.
Yeah. So well, you and I have lots to talk about. So
we do.
Because I have some other.
I love when we talk.
I love our chats too. I have some other stuff I wanted to talk to you about, but we can talk about it off meeting.
Okay. Okay. Yeah, great.
So, we'll talk more about that, but I think it might be helpful to reach out to her and her husband and see if maybe they can collaborate in some way. So.
Okay, so I'm adding, thank you so much, Jennifer. So I'm adding to this list. I'm going to add faith communities, and John, I'll be in touch with you about that. You can be our contact. Aspire.
What about the schools, Lynn? Obviously, we'll just have to work those things. Like, is that something we'll work through like we usually do? You know, that.
Well, I think,
it's
Andrew,
kind of difficult.
Andrew, correct me if I'm wrong. One of the things we talked about was the mail distribution site. And that goes to a lot of families that are in school.
Yes, that's correct, Lynn. Yeah, so we actually have that kind of on the agenda for our February 4th meeting too. So we'll kind of meet with Director of Food Services, Sarah, on that.
Sarah,
So they kind of distribute a significant amount of meals each week, and so we wanted to kind of leverage that process that they had.
They send out. Oh, they could send out info. Okay.
Yeah. So okay. Does anyone have anything so often? This has been a great conversation. I'm sorry, it's getting late and we're over time, but can someone collaborate with Bashi? Yes, we're going to be talking at that meeting on February 4th with the school administrators, and Melanie Bennett is on that call. She represents the chair of, she's the chair of Bashi. So yeah, so we will be talking to them about this initiative as well.
Even though this, I'm sorry, Marion, go ahead.
What does BASHI stand for exactly? Just because I know that
Braintree Alliance for Safe and Healthy Youth. Okay,
thank you. Because I know a lot of people don't know exactly what it means, what it is.
Yeah, that they've been around for a long time. Because I remember years ago when I was working in another community and was involved with a local the CHNA, the Community Health Network Alliance. They were there. They were around before the partnership. So
great. Thank you, honey.
But right now they're predominantly working within the schools, and I've been attending some of their virtual meetings. So
yes.
Bye, Freddie.
Hi, Freddie. I was just gonna say, Len, that and to everyone, that even though this care package is a physical care package, we'll probably have a digital version for everyone who wants to be able to distribute at least the resource list, and get that up onto their own social media and distribute that that way too. So even though if you're not on the potential partners for the physical one, we'll probably contact you for the digital one.
Awesome. Thank you, Stormy. Okay, so I just want you to know, Anna, we have been working on this and we got more input tonight, and we have a follow-up meeting soon. So we'll
next week, I think.
Yeah, next week. So we'll be chatting more about it. So thank you.
Looks great.
Thank you very much. Anything else that Mopsy, Sapsy, anything you want to add, Brianna? Is there anything? I know we produced some videos, and
yeah, for the sake of time, why don't you just share them
next time?
Up. Yeah.
Yeah. Okay. Awesome. Okay. Great. I'm very proud of what we did, and I'm looking forward to showing some videos that we produced, that explains about what our coalitions do. Very quick, and colorful, and I think it's going to be great. So, okay. Thank you, Brianna. Moving on. Next. What's next? Announcements, updates, events. Does anyone have? I think you can go to the next slide, Steve. If anyone has anything they want to discuss. Oh, we got the dispatch going here. Does anyone have anything else anything they'd like to discuss or something, update or share an event or anything, virtual event coming up? Now's the time. Okay, yes.
I just wanted to say, I know you and Marianne know, but for anybody else, I live in Braintree, and I am a yoga and mindfulness instructor and a Reiki practitioner and a wellness coach. And I'm happy to be a part of, I know wellness and mental health is, it's always something that we need to be concerned about, but especially now with the pandemic. So I'm happy to help bring some programs in. If anybody's interested, you can feel free to reach out to me.
Jennifer Lynn.
Not to like plug myself, but I'm like, all these ideas are coming through as all these people are talking, and I'm just trying to think, like, even if it's offering a yoga class, a short mindfulness session, whatever I can do to help in any way, definitely feel free to reach out to me. You can get my information from Lynn, or contact me directly. But I just wanted to throw that out there. If anybody's interested, I'm happy to talk. I can work with kids and adults. So just throwing that out.
And Jen's awesome. So thank you, Jennifer.
Thank you. Thank you.
We'll talk soon. I know I owe you something. So, okay, awesome. Thank you. So if no one has anything else to share, we can move on to the next slide. Let's see, nurture. Okay.
Lynn, I just want to recognize.
Yes, Steve.
Well, I think he just raised his hand. Yes.
Mm-hmm. I'm sorry?
Noel raised his hand, so I just.
Oh, Noel.
I don't know if you had something to share. So.
Noel, are you there? No. Okay.
There he is.
Oh.
He's muted.
Oh, he's muted. You gotta unmute yourself.
I apologize for that.
Hello,
I don't know
Noel.
what, for some reason I couldn't see myself or raise my hand or chat or anything. Everything was disabled. If Jennifer, if you can put I just wanted Jennifer to put her information in the chat so that I can follow up with her, because we at Moore, we're actually putting together a new book of resources, and I'd love to be able to have all the resources that are in each one of my areas, and Braintree being one of them. If you could just put your information, Jennifer, inside that chat box, and I can copy it and pass it on so that we can add it to our resource book, that would be really great.
The people who don't know Noel, for the new people in the room, Noel is with the MORE, stands for the Mass Organization for Addiction Recovery. And we're very happy to have him. And I know they have a great resource book that they update usually yearly. So that's it. That's great. Thank you for reaching out about that, Noel.
Thank you.
Anything else? Let's see, what else is there? What else do we have here? Next slide. Okay, so I did talk about the DFC grant. As you can see, the application due date is May 15th. The estimated post date is March 15th. Jennifer Lynn. Okay. So anyway, this was on grants.gov. So we are gonna make application for the Drug-Free Community Support Program grant. I spoke with Nicole Taub, the chief of staff, today, and talked to her about this. And so I am going to be looking for a lot of help from people and some data. So I'll be in touch and I'll let you know how things are progressing with that. Thank you, Jay. And let's go on to the next slide. I think it's just maybe a motion to adjourn, probably. Oh, next meeting date is February 24th, and we will start at 6 p.m. via Zoom. And next slide, Steve. Action items. I don't think Diana is here, so and it's late, so I'll just send out the action items I have. I kept the list.
I wrote down some too.
Hi,
Thank you,
Liz,
Mary
I
Ann.
have a question for you.
Yes.
Are in the upcoming weeks or months, are we gonna have any more in-person events like the recovery tree that we did, or anything like that, since it is the new year?
Yes, every year we do the International Overdose Awareness Day. We do the Red Ribbon. There's a lot of things. Yes. Unfortunately, most of those events happen in the fall. Like in the fall, we just have go from where every month is every week. It seems like we have something. Yes, those are all scheduled events, and we will be talking about those probably next month or the month after that. So people are aware, and we'll do the Family Day thing again. So yes, I hope that answers your question, Mary.
May I just go to be notified? Key holder mentioned that the back door.
Mike.
Does anyone have any other questions? And I
just quickly, I think when Mary was asking about the events and stuff, we do, like, for the kids up at the high school and stuff, we do like the medication safety, maybe.
Yes.
The take back cigarettes. I mean, we can do things that can involve them virtually and try to, get them something to look, a project of some sort, maybe.
Absolutely. And I'm gonna try to connect with the students that are here with us tonight to talk about those initiatives. The 84, there's, you can create an 84 chapter within your school, which is anti-smoking, quit resources, all sorts of stuff. So vaping,
a lot more fun than just this meeting.
A lot more fun, yes, than just this meeting. We do a lot of stuff in between. This isn't just what we do. So so thank you all for being here tonight. I think the last slide is probably the motion to adjourn. Oh yeah, so just plus delta. Does anybody have any feedback? What went well or ideas for future improvement? If anyone wants to chime in now or send me something via email, we can do that. you can just send it via email. Thank you. Next slide, Steve. Motion to adjourn. Okay. I'd like to entertain a motion to adjourn, and any of the people that are listed here can make that motion.
Second, or make the motion to adjourn, please.
Okay. Oh, no, it has to be someone from this list. Was that you, Kathy?
It was. I wasn't reading at the same time.
Okay. So Steve, would you like to make the motion to adjourn?
I will make the motion to adjourn.
Andrew, would you second that?
I'll second it, Lynn.
Okay, motion to adjourn. Diana Clary, she's not here.
Not here. No.
Christine Fosco's not here. Steve Leary.
Yes.
Andrew Marin.
Yes.
Derek Top. He's gone. And Mike Want. He's gone too. Okay, but we have to do that. Unfortunately, it's the way that these municipal meetings go.
Sorry about that, Lynn. I am here, and I vote yes. I have
okay.
Me too. I'm here still, if you can hear me.
Thank you, you guys. I really appreciate it.
Thank you.
Thank you. Great job tonight, everyone. Next slide. I think that's it.
That's all she wrote, Lynn.
That's all she wrote. So be safe, be healthy, and I'll see you guys soon. And I'll be reaching out to everyone for follow up on action items and all that. Have a great night. Thank you so much for being here. Bye.
Thank you. Bye.
Appreciate it.
Lynn.
Bye. Yes, Mary. Did you wanna set up a time?
Yeah, sure. For what exactly?
Just to talk about youth initiatives and all that kind of stuff. Do you wanna give me a call or what works best for you? I know you're in school during the day, so I don't want to.
Yeah. Now that we're going back like 4 days a week, so like I could normally do Thursday and Friday, but now I can't because I'll be in school. Except for next week because it's starting the 1st. So if this upcoming week I can meet Thursdays and Fridays.
So that's next week, or this week?
Week after.
The week after. I can meet Thursday and Fridays like in the morning.
Okay.
Before noon. Or I can just do after school because I'm not doing anything.
Okay. I know it's a bummer. Okay. All right. So I'll be in touch, definitely. Thank you so much.
Okay. Do you want my number? Or I think you already have it.
I have it, but you can give it to me again.
Okay, it's 781.
Yep.
917. 4392.
4392. Great.
It might be easier to text me just because I get so many college emails that sometimes I miss a lot of actual emails. So
awesome. Did you get accepted anywhere?
A few places, yeah. Regis, Curry, and UNE, and then I'm waiting from Emmanuel.
Awesome. Nursing, correct?
Yes.
Yeah. Awesome. Great job.
Okay. Good to see you.
All right. Good to see you all. Thank you so much, Steve.
Bye.
Thank you for being the guy that moved the slides along. And
happy to do it, Lynn.
All right. Thanks. Have a good night.
You too, Lynn. See you, Mary.
Bye. Bye, Marianne.